Hello folks, I'm Dr. Fazil. I'm a kidney specialist as well as internal medical specialist as well. You're watching Dr. Fazil TV show, May 2024 episode. The topic of discussion today is lightheadedness or dizziness. And the reason I chose this topic is because in my medical practice, I see a lot of patients complaining this problem. And I think it's a very important problem because if you're not able to walk straight in the right fashion or not able to drive after the dark is set, and then it becomes really a very important problem in your daily living and to perform your day-to-day tasks. Plus, it's also become a dangerous situation as well because it can lead to accidents, it can lead to falls. If you fall, you can have a fracture, you can be on the floor for days, if you're living by yourself, and it can cause its own ramifications, own consequences, as well as, if you fracture a bone, as we know, with the time, the bones get weaker. So one fall can do it, and if you fall and break your hip, and the mortality of hip fracture is pretty bad, 80 to 90%. So it is not ordinary symptom; it's important symptoms. Therefore, do address with your providers when you see them. If you do have dizziness or lightheadedness, don't keep it up to yourself because it is an important issue. So let's talk about what really is the difference between dizziness, lightheadedness, and vertigo, right? So most patients just say they feel dizzy. That's the common complaint. But as the providers, when we start to investigate or start to look into that problem, mostly I typically ask the question, okay, is it the symptoms as you are on a merry-go-round and you stop? And you can see on the screen on my back, what happens if you are going on a merry-go-round and then you suddenly stop, or you're spinning around in a circle and you suddenly stop. You feel like you're still spinning. That is generally known as vertigo. That's not lightheadedness. So with vertigo generally comes some nausea. It is the same kind of symptoms you will get as you have motion sickness. For example, if you're on a cruise or in a backseat of a car and you cannot see an outside reference point, and the car is moving in the circles, or going up, going in the mountain terrain, you will feel nauseous. That is motion sickness. So it is the same mechanism. Obviously, the environment is different. You can have it at your home as well when you're not spinning. And generally, the reason is two reasons. One is ears. The ear have three different parts. External ears, you can see on the back of my screen, on back of the screen on my back. The external ear, the middle ear, and the internal ear. The middle ear holds a mechanism to receive the sound waves from external ears and then amplify in the middle ear and then communicate through internal ear to the brain through a nerve. We call it 8th cranial nerve, right? It goes to the brain, and there's a portion in the brain you can see on my back screen. There's a portion of the brain which receives your audio, the voice. But there's a portion of the same nerve which take the balance receptors information from the middle ear. And let's say it's like your gyro, if you're twisting in off the balance, one side or the other, there's a certain cells in the middle ear which transmit the information to that 8th cranial nerve that, hey, a body is going in one direction. And generally your eyes, which have another nerve which goes to a different part of the brain, they coordinate together. So it says, yes, you're moving to the right. The ear says, I'm moving to the right. Eye says, I'm moving to the right. And you don't feel symptoms because that is the normal response. But let's say if your ears are saying, hey, you're going on the right side, and eye says, I'm not going the right side, I'm seeing straight. You feel dizzy, right? That is actually not dizzy, that's a vertigo. So obviously the problem could be in the ears, chronic ear infections, loud exposure to loud noises over a period of time, gun blast, or factory workers with loud noise. People have been exposed at their job site or whatever they do, which expose them to a loud noise. So that can damage the ear portion of the ears, which can transmit the nerves, the balance, and it can cause that problem. Generally, it comes with the ringing of the ear as well. We call it tinnitus. So we ask if you have tinnitus, if you feel like things are spinning, if the symptoms get amplified when you're not able to see, because when you're seeing and your ears are not, you can kind of adjust your gait and stance with the reference of your eyes. With your feet, you can see, okay, I'm not twisting, I can still readjust it, right? So there's some people develop the endoscopic mechanism.
The Dr. Fazil Show is now available to view at home on Roku devices and YouTube. Catch up on your favorite episodes right on your phone, available on YouTube and the BioFamily Clinic app. The Dr. Fazil Show is available in many doctor offices across Yuma, Arizona. Pick up your free copy of Health Tips magazine, available throughout Yuma, Arizona, or read our digital version at healthtipsmagazine.com.
This symptom get more amplified in the dark situations because you don't have any reference point. So the patients with this kind of complaints, they tend not to drive and that should be right move. Don't drive in the dark point because they are not able to have that reference point of the eyes because they're darkness, and they become spatial disorientation very easily, right? So, but that can be fixed. Again, you have to give the right information. The provider have to ask the right question, do the right examination. And generally, it's a chronic infection in the ears, ear wax sometimes, infection in the ears, that could, if we can fix that, with the right diagnostics, and then appropriate treatment, then yeah, that symptom will go away. So that is vertigo. Another portion of vertigo, remember we discussed that ears transmit the information to your brain. So if there is damage to the nerve or to the brain, for example, if you have a stroke, or brain tumor, that can also cause same symptoms. So it is important to recognize that the brain plays an important portion of that. So people who have stroke in that particular area where the balance sensation goes, they will have similar symptoms, right? So that's 3 out of 2 problems we discussed: the ears, the brain. So yeah, with if you take a imaging of the brain with MRI or CAT scan, whatever modality is necessary or required at the time, and if you can see it's the stroke, that will. So the idea is, okay, to prevent more strokes. Obviously, stroke is already done; it's irreversible. But then doing some balance exercises, would help to override those symptoms over a period of time. So we recommend balance exercises. It generally is a little bit, few days procedure, is done by the rehab people. They know how to do it. The ear portion can be done by another kind of balance exercise. We call it Apley's maneuver. You can see on screen on the back how the Apley's maneuver is performed. So that actually readjusts the crystals and put back in the right portion of the socket in the ears. So balance exercises, prevention of stroke. If you do have a stroke, then rehabilitation will help, and that's an avoidance of situation in which you don't fall and don't have the downstream effect of that dizziness would be a good idea. And there's some medications too, the same medications which we use for motion sickness, anti-vert. If it is the ears issue, wouldn't work for your brain. That will help, so you can use it as you need it. So between physical exercises to readjust your balance, adjusting the primary issue like infection in the ear, and then medication as you need it would help. So, but that's one portion of it. The other portion is that you also receive information not through the ears and the eyes, but also through your feet as well, right? If your feet have numbness and no sensation, so as long as you can see it, you can probably adjust your balance. But the moment you close your eyes, the patient tend to fall one or the other side because they have no reference point. So you can see on the back side, the person has closed the eyes and they're falling on one side, and they open their eyes and they can see, now they can readjust it. And that happens if you have neuropathy or numbness in the feet. And then I also have noticed that if they have too much swelling or edema in the legs, they also tend to lose sensation. So that's not neuropathy, but because of the swelling, the fluid has built up between the skin and the surface, between the shoes and the receptors, and they're not able to feel anything. So lack of feeling in the feet, neuropathy or swelling due to water, excess of water in the legs can also cause same symptoms. The treatment would be different now. Now you have to just make sure the heart is fine, patient is not able to, they don't have any issue with retaining urine in the bladder, and that's causing accumulation of the fluid in the legs. So it's a fluid issue, right? The fluid issue, and if there's a neuropathy, and neuropathy have multiple reasons. Neuropathy means bad nerves to the legs, or if it's neuropathy of the legs. That's another topic, but if you have numbness, tingling, yeah, that's a neuropathy, and that need to be dealt a different fashion. Again, you diagnose the source and then you fix it. But do understand that neuropathy, swelling in the legs, that's an additional cause of similar symptoms. Right, now let's talk about others related symptom known as, so we talked about dizziness. Now we're talking about lightheadedness. So lightheadedness is different. So lightheadedness can happen when people suddenly stand up and they feel like they're going to pass out. And you typically ask, is this the same symptom as you will tend to, rotate and spin and then stop and you're still rotating? They say no, it is different as I'm going to pass out. So that's lightheadedness. So generally that means the blood pressure is dropping down, and as the patient changes the posture, they stand up and the blood pressure tends to fall down, and it's not going to the brain. The brain is not getting signals like enough blood supply, enough oxygen, and they feel lightheaded. Okay, what could be the cause, right? Let's say if there's any blockage in the carotid arteries is right here, and they're tight, so that need to be checked, because if there's no good flow of the blood to the brain, yeah, that can amplify when you change your posture. Low blood pressure over medication, that can also cause drop in the blood pressure. Number three, if the heart has any valve, like a leaky valve, one of the valve is aortic valve. You can see on the back of on the screen on my back. The heart has 4 chambers. Each chamber have valve in between. One of the valve is aortic valve. That is the valve which goes from your left ventricle. You can see on the picture on my backside, into the aorta. Aorta is a big blood vessel, and it gives blood to all part of the body, including the brain, right? So if you have a tight aortic valve, that can slow down the flow of blood to your brain, and that can cause. So heart issues, carotid arteries, which is the artery which connects your heart to the brain, blockage in that area, over medication, all 3 can cause lightheadedness. Dehydration is one of them. If you're dehydrated, you do not have too much volume in the blood, so when you stand up, it can definitely amplify lower supply of your blood to the brain. So now we have discussed the lightheadedness. And the last cause is again, there are multiple causes. I'm trying to pick up the most common causes so we can make it easy for you to digest. Over medication. A lot of people have medications which can cause like lightheadedness: gabapentin, Neurontin, Lyrica, amitriptyline. Those are the medications which can cause lightheadedness as well. So, and over medication of the blood pressure. I've noticed that when people start to lose weight, and what happens is that losing weight and they're on the same blood pressure medication, so they don't realize it that those medications need to be lowered, because blood pressure is very sensitive to the weight. So if you lose like 10 pounds, or 5 pounds, you will lose 10 degrees of the blood pressure. And if you taking the same amount of blood pressure medication, you can literally pass out. So it's a good thing to have it, but make sure that it's being addressed properly. And the provider can check your blood pressure sitting and standing. If blood pressure is too low when you're standing up, and if you're taking blood pressure medication, and either the dose is too much, or there's a drug interaction, or if you have lost weight, hey, go ahead and lower the medication. But I will have your provider do it, because it's kind of more complicated situation. So they have to pick up which medication they need to lower it. And as you keep losing weight, if you're on a weight loss program, then the medication need to be adjusted every single time till either you don't take medication at all or very minimum medications. So that will help you with staying away from that problem. So folks, on that note, I'm going to wrap it up. So we discussed today about the most common cause of dizziness, lightheadedness, as starting from the get-go. Please do explain to the provider what do you really mean by that, because all dizziness does not mean the same thing. Obviously, if there are 2 different or 3 different problems, then the cause is different. Once you find the source, you can fix it. Once you fix it, you can have a happy life thereafter. So on that note, folks, I will call it a day. God bless you. God bless America. I will see you till the next time. This was Dr. Fazil Show on dizziness. Have a nice day, folks. Thank you for staying tuned.